arthroscopic TFCC repair using modified outside-in technique. There are no disclosures and there are no conflicts of interest. The instruments required for a successful repair are two 21 gauge sterile hypodermic needles, one 20 PDS suture, a small straight or curved hemostat, and a sterile marking pen. Since both the needles are used in line for the repair, the second needle is marked with a skin marker for easy identification. It is difficult to load the needle with PDS from the side of the needle hub. Hence, it is loaded with PDS from tip of the needle. The second needle marked with a marker is loaded in the similar fashion. The tip of the needle is slightly bent to prevent disengagement of the suture during insertion. The first needle is passed from the capsule across the tear. The PIP demonstrates the needle passage from 6U port and the suture is advanced into the joint. This suture is retrieved and parked from the 6R port. The second needle, which is marked with a skin marker, is advanced with sufficient length between the needles to form a loop and is inserted from 6U port through the joint capsule. PIP shows passage of the second needle. The loop inside the joint is widened with a hemostat and the first suture is grasped through the loop and placed in 6R port. At this point, needle number 2 marked with the skin marker is completely withdrawn from the suture. Now there are 3 suture strands outside the joint. 1 suture strand is inside the needle and 2 strands outside the needle. The strands outside the needle are pulled together, which retrieves the first suture and is ready to be tied. Inline needle configuration avoids the confusion of the strands to be pulled, avoiding inadvertent unloading of the suture. PIP shows the suture retrieval. The knots are then tied on the joint capsule from the 6U port to complete the repair. Any configuration of vertical or horizontal suture can be used for a sound repair. This method has a distinct advantage of having a smaller hole in the TFCC and reduces the chances of laceration. Thank you for watching.